Hello, my name is Ioannis Georgakopoulos. I am professor in the University of Bari Aldo Moro in Italy, and I represent WAGRO, the World Academy of Growth Factors and Stem Cells in Dentistry. I would like to thank a lot Dental XP that gave me the opportunity to be with you today and talk to you about the IPG sinus technique, an innovative technique for implant placement and grafting into the sinus without sinus floor elevation. Very often, in the posterior areas of the maxilla, we have not enough bone to place implants, so we have to go through the sinus floor elevation procedures. The first who did that has been Oscar Hill Tatum in 1974, and there are two basic methods to do sinus floor elevation: the lateral window and the crestal approach. The first method, the lateral window, is a big operation. Not every dentist can do it. And during lateral window, maybe we have different kind of complications, like bleeding if we damage the infraorbital artery, edema, infection, sinusitis. But very often we have Schneiderian membrane perforation, and this is not always easy to repair. The second method, the crestal approach, is a less invasive technique of elevating the sinus floor, and during this technique we use non-traumatic expanders. But this technique has also some limitations. We must have at least 5 to 7 millimeters of bone, because we need bone to have initial stability. And if happens to have a sinus membrane perforation, is not easy to repair. So we have two basic methods for sinus floor elevation, the lateral window and the crestal approach, but we have hundreds, maybe thousands of other similar methods and techniques. All these techniques have a common point to success: no perforation of the sinus membrane. IPG sinus technique, it is not a sinus floor elevation technique. It is not a lateral window, not either a crestal approach. IPG technique is based on molecular biology, autologous growth factors, stem cells, and their properties. IPG sinus technique is an automatic implant placement without sinus floor elevation by using autologous blood delivery biomaterials and with intentional perforation of the Schneiderian membrane. Let's see this CBCT X-ray. Which treatment plan will you recommend? We can place implants in the maxilla. I'm sure you will go to tell me we have to go through sinus floor elevation procedures because we have not enough bone. Maybe we have 1 or 2 millimeters of bone. So if we do sinus floor elevation in this case, maybe we have to do general or big local anesthesia. We have to do a big operation, maybe more than one operation, because first we have to create bone to do the bone regeneration, and after place implants. Maybe we need transplantation. Very often we have intra and post-operative complications. We have long time treatment, big cost, and special doctors. With the IPG technique, you don't need to do sinus floor elevation. No big operations, no transplantations. Usually we don't have intra and post-operative complications. We don't need long-time treatment or a big cost or special doctors. With IPG technique, we can do implant placement and grafting into the sinus all in one stage surgery. The classical sinus floor elevation treatment plan includes one or two-step approach. If we have enough bone for initial stability, we can do bone grafting and implant placement at the same time in the same session. But if we have not enough bone for initial stability, first we have to create bone, we have to do the bone regeneration, and later, few months later, to place the implants. So we have to go through two-step approach. These are the procedures for sinus floor elevation techniques. Let's see these X-rays. We like to place implants in the posterior maxilla, and we have enough bone for initial stability. So we can go through lateral window, crestal approach, or IPG technique. And you see that we place 3 implants in one session in this area of the maxilla. This case we confronted with IPG technique, but you can do it also with classical sinus floor elevation procedures. But in this case that we have very little bone for initial stability, what we can do? Yes, of course we can do the classical sinus floor elevation, and I'm sure we need to do it by a lateral window. But we can use the IPG technique, and we can place implants into the sinus with IPG technique. And during one of my lectures, someone asked me, what is going here? What is going on with this implant? Is flying into the sinus? No, it's not flying into the sinus. We go to see exactly how we can place this implant into the sinus and how we can have initial stability for this implant by IPG technique. IPG sinus technique is using autologous blood delivery biomaterials like biological membranes and bioactive membranes, as well as bone grafts and titanium mesh. And together with the autologous growth factors, we can have also mesenchymal stem cells. And this is very important if we like to have bone regeneration. During IPG procedures, we immerse the implant into the growth factors to create a bioactive membrane. And regarding my opinion, this bioactive membrane is the best implant surface because it's a surface full of autologous healing and regenerative proteins around the implant and offers a better and faster osseointegration. There are a few publications on human beings place implants with and without growth factors, and the results demonstrate that the addition of growth factors had a significantly positive effect on bone formation. I'd like to show you now a video to understand better the kind of biological membranes that we use during IPG. For example, this biological membrane that we call it ATH IPG membrane, and ATH means Athens, because first we create this membrane in Athens, Greece, has a very big elasticity strength. This membrane may gain weight more than 380 grams. Remember that an implant weighs half gram. We'll go to place more instruments and see the strength of this biology membrane. And we bring more instruments. So I repeat, this membrane that is coming out of the blood of the patients is an autologous membrane that we can create in 10 minutes, and we call it 88 IPG membrane with a very big elasticity and strength. So these membranes have a very big elasticity and strength. We place the membranes into the sinus before the implant placement, and the implant is never in contact with the sinus, is always inside the growth factors. And also, when we screw the implant blocks these sticky membranes around itself. And I repeat, this membrane gain weight more than 380 grams, and an implant weighs only 0.5 grams. We know very well that the properties, the elasticity and the strength of this membrane is due to the incorporation of adhesive glycoproteins. During IPG technique, we can use also titanium mesh for better initial stability. There are small titanium membranes like a circus or a butterfly, and we can screw them on the implant to give initial stability. More initial stability. First is the biological membranes, and after the titanium mesh to give initial stability to the implants, especially when we have not enough bone. There is research from University of Geneva and has been published on the Journal of Laryngoscopy in the United States. 5 years follow-up, 83 implants with sinus membrane perforation, and no post-operative complications in the sinus. Here we can see 2 X-rays, panoramic and CBCT from the same patient, same case, that we can place implants with IPG technique in one stage surgery. And we placed in both sinus in one session 6 implants with IPG technique. And this one is another publication of IPG sinus technique. I like to show you now one of our cases many years ago, is almost 10 years ago, this case, one of the first cases we did with IPG technique. And during this case treatment, we place implants in both sinus. You can see the biomaterial around the implants into the sinus. And this biomaterial is a sticky biomaterial because it has the properties of the platelets. The growth factors are into the platelets, and so they have the same properties, are giving us sticky biomaterials. 8 months post-op, we did the Hostel test, and the measurements were between 63 and 69, providing high implant strength. I like to show you CBCT detail pre-op and 4 months post-op. And you see how is the bone, very little bone, pre-op, and how the bone starts to regenerate around the implant 4 months later. But 8 months later, 8 months post-op, we saw a huge bone formations over the sinus, almost 10 millimeters of new bone formations. And we were really wondering, what is going on here? It is really bone? So we did a biopsy and with the University in Brescia in Italy, and we found out that is really bone regeneration into the sinus with the IPG technique around the implant. The patient of this case disappeared. We haven't seen her for many years, and she came back last year after 9 years. 9 years post-op, and she came back because one of the bridges get off, and she wants to put back the bridge. So we take panoramic X-rays, and we saw the panoramic pre-op and 9 years post-op. The implants are still there without any problem. And this is very, very important because we have a lot of cases with long time follow-up. Let's see another case. Let's see details of another case. We see that we have almost 3 millimeters to use them for initial stability. In 2 months, we see that we have bone regeneration, and in 4 months we see that we have full osseointegration. In this case we use allograft, so we think that allograft has faster osseointegration. IPG promising results demonstrate that it can be considered as a reliable alternative to sinus floor elevation procedure. It's a promising technique that needs, of course, more research. And for the dentists who want to do it, they have to be experienced. Let's see a video to understand better how the IPG technique works. Very often, in the posterior areas of the maxilla, we have not enough bone to place implants, so we have to go through the sinus floor elevation technique. But IPG sinus is not a sinus floor elevation technique. With IPG, we don't care about the Schneiderian membrane, but we use the initial drills for intentional perforation of the Schneiderian membrane. So we perforate the sinus membrane. We use special instruments to condense the bone. We don't like to lose bone because the bone is not very good, it's not very dense, and we like to keep as bone as possible. The preparation of the site is always a preparation less dimension than the implant dimension, because we like to use an implant with aggressive threads and use it like a screw. Condense the bone, keep the bone, and use an aggressive thread implant. We place into the sinus the special biological membranes that are very strong with a big elasticity, and we place also bone graft material. After we prepare a bioactive membrane around the implant, we immerse the implant into the growth factors to create a bioactive membrane. Very gently and by hands, we screw the implant into position, and the implant blocks the biological membrane around it. We can place also a titanium mesh or a collagen membrane as well. In a few weeks, we have the sinus membrane reconstruction, and in a few months, we have the bone regeneration. This is the IPG technique. Is a technique with intentional perforation of the Schneiderian membrane. We have also the IPG technique evolution. Let's see some examples. If we have a case like this one, and we like to place implants upper left, everybody, I'm sure, will tell me that it's not possible to do it immediately. First, we have to create bone and later on place implants. Let's see another case. Also in this case here, we have no bone. We have a tooth, we have infection, we have no bone. I don't think you can place implants direct with sinus floor elevation. This case also, another one case, upper left also, we like to place implants. We cannot do it direct with sinus floor elevation technique, but with IPG technique we can do it. Let's see, extraction very gently. Use special instruments for condensed bone, use growth factors and stem cells, use bone graft materials, place the implant with a bioactive membrane and place also a titanium mesh. Also in this kind of cases, we can place an implant and we can do GBR upper and under the previous Schneiderian membrane. In this case also you can see the implant, immediate implant placement, and you can see the titanium mesh that gives the initial stability to the implant. IPG technique has many advantages. You don't need to have too much bone for initial stability. We have minimal postoperative complications. No importance of sinus membrane perforation. We have no pain, edema or hematoma. Reduced chair time. Less graft material needed. Overcoming anatomical obstacles. Short learning curve, minimal cost. Due to growth factors and IPG sinus technique, current surgery in sinus implantology is now simplified and improved post-op and our patients' life quality. Of course, you have to be experienced. I'd like to thank all of you for your attention. Thank you very much.